But why don't we go ahead and get started with our Bellos lecture. This is such a highlight for the year, for the school. It's such a part of our tradition, and we've had such wonderful speakers over the years, and today is certainly no exception. We then always have, of course, the reception afterwards, the Whistler tea. And of course, there's history and story to that as well, and Sten is happy about the tea because he's an Anglophile, but we will have the reception following. It's such an honor and a personal pleasure for me to be able to introduce to you Dr. Sten Vermund, Dean of the School of Public Health. Sten and I go way, way back when I was a little student and he was a baby faculty back in New York City, back in the days when the HIV pandemic was starting. Sten is a Yale and national resource. Trained as a pediatrician, obviously a public health expert, and I'm going to say an honorary nurse. He has always gotten the power of public health and nursing working together. Sten's done it all. Okay, so sure, he's an infectious disease epidemiologist. We all knew that. We've all seen him on the media, and as he's helped Yale respond to COVID during this pandemic. He's a pediatrician by training and practice, and I think those of you who are pediatricians and adolescent medicine will appreciate that clinical perspective. He's focused on improving care in every setting, I'm going to say. He has worked in multiple countries around the world, always thinking about how do we get to equity, which of course is our theme at Yale School of Nursing. He's worked on HIV, HPV, TB, parasitic diseases, and of course coronavirus, just a handful of the pathogens that he has brought his bearing and his expertise to, and collaborations with so many people around the world. He is interested in interventional science, and he led the HIV Prevention Trials Network for many years, a huge endeavor. And so that has really moved the needle on a lot of our HIV prevention clinical trials and implementation science, which is a theme also here at Yale. And it's always about, as we care about as nurses, increasing coverage, quality, evidence, and impact of care. He has, as I say, experience in the real world, in academia, and also in NIH. And so those of you who may have been around during the HIV pandemic, he was one of those incredible bridge people who could work with the activists, people living with HIV who were dying, who were trying to make change in how do we do science so that people can survive. He came up with the first women's cohort, HIV women's cohort. I think I remember you being on stage with Jim Curran and the activists were throwing toilet paper at you all. And you just kept speaking, you heard the concerns, and change was made in the way we do science and what you did at NIH. Very, very incredible. Of course, in this most recent period, as Sten has been leading the School of Public Health, our sister school, he also pivoted towards COVID-19 research, including work with collaborators in China and around the world. He worked with Yale economists here on these are just some examples on mask use, safety with schools and arts organizations in New York City, New York, as well as in Connecticut. And he has really continued all that work, along with his incredible faculty who are collaborators of many of ours at the School of Public Health. He's, of course, has reached the pinnacle of achievements in being recognized for his science and his contribution. He's elected member of the National Academy of Medicine, fellow of the American Association for the Advancement of Science. I'm sure I'm missing a lot of accolades, but really the most important thing is he's a genuinely kind and smart and warm collaborator. He champions people. He wants everyone to be doing good work, and he helps support us all in doing that, including in thinking about nursing and public health partnerships. So he's embodied that. As the Dean of the School of Public Health. He was instrumental with us as we formed the Yale Institute for Global Health, remembering that the three of our schools really launched that. And so I didn't announce this to you before, Stens, but rather than getting you a Yale bowl or a Yale pen, we're going to plant a tree for you. Oh, and that will be our gift to you, and thank you for speaking today, particularly given the topic, which is the topic of our time. And that tree someday will grow and shelter and be felled and turned into a bowl for someone else. But for you, it'll be the tree. Thank you, Sten.
Thank you, Ann. Thank you very much. Well, that was very kind, very generous, and I'm really thrilled to be here. I came shortly after my arrival in 2017 over to the school, marveled at your space, salivated, and was really impressed with what you were doing in the school. That was the time you were doing your simulation labs, you were building them, and there was just so much vibrancy and excitement in the school, and there still is to this day. So I'm bringing a relatively familiar topic to you, so I hope I can give it some novelty and a little bit of perspective. So what we're going to try to do is take a look at the latest data I could find, and just remind you that prior climatologic predictions from greenhouse gas release have actually understated true effects. This is, if we've learned anything in the last 12 months, it's that all of these dire predictions, it's the upper 95% confidence interval that we're tracking, not the middle, certainly not the low. So we'll review a few climatologic highlights, discuss mitigation efforts, implications for human health, for example, strategies for adaptation to planetary warming, relevance for loss of habitat, species diversity, comment on human population growth, and we'll end with a comment about nursing as a vital element for climate change adaptation. Now, it took me, I'm not quite the guru in this topic that Anne is, and I would muddle my use of the word mitigation and adaptation. I'm going to put it out there just because I learned it. Now, if I'm a carbon capture engineer, or if I'm somebody working on policy to guide us to set our thermostats properly, or to massively improve solar power, or improve the efficiency of machinery so it uses less energy, then I'm mitigating climate change. But if I'm just a pediatrician with a background in infectious disease epidemiology, and I'm looking at island nations that are being inundated, or I'm looking at malaria zones that are expanding, and I'm trying to help cope with that, that's adaptation. So what we really want is we want mitigation, but guess what? We nurses, public health professionals, docs, and health providers have to worry about adaptation, because that's our space. That's the space where we think we can actually make a difference. So let me make sure I can get this to work. And here, you've seen this before, many of you. From 1880 to 2021, the more yellow and the more red, the greater the deviance from historic norms. And take a look at the poles, how much red pops up at the poles. I guess we're at 1990 now, and we're coming to 2000 and 2010 and 2021. Oops, didn't mean to show it twice. Okay, so the annual mean surface temperature anomaly is what the meteorologists refer to when they're doing these historic temperature gradient comparisons. And the past 8 years have been the warmest in recorded history, as per the World Meteorological Association and organization, and as per everybody else. No matter who is analyzing this, they all say the same thing, even with different methods. The last 8 years have been modern history's warmest 8 years. There are record levels of heat-trapping atmospheric greenhouse gases. The global temperature about 1.1 degrees higher than historic norms. And you know that we're trying with Paris climate change to keep it to under 1.5. And we're not going to get there, actually. But we need to work today to make sure we keep it under 2. So this is the 7th consecutive year where global temperature has been more than 1 degree Celsius above pre-industrial levels. And you know the consequences are massive loss of sea ice and ice sheet mass, sea level rise. We've got longer, more intense heat waves and major habitat changes affecting humans and animals and plants alike. And I'm just straining to see. So the upper map is global temperature trends 1901 to 2017. And the lower map is 1988 to 2017. So just to give you a sense of the comparative analysis. And the greenhouse gas trends are unremittingly grim, up, So here's another fancy, Sten can barely cope, video. Okay, so now we start in 2002 and we take a look at the Greenland ice mass loss over about a 19-year period, and we'll be coming up to 2020. And this is Greenland ice loss and meters equivalent relative to 2002. And when we're measuring here, this y-axis is mass loss in gigatons. Now, I personally have no concept of a gigaton other than it's a heck of a lot of ice. That's my technical interpretation of a gigaton. It's a massive amount of ice. And one more time, and this is Antarctic ice mass. That was Greenland. Now we have Antarctica. And this is from 2002 to 2019. And taking another look at 150 gigatons of lost ice mass per year. What happens is that these sort of glacial features are almost like the stopper on a bottle. And when you take the stopper off by melting, and you might have the separation of a distal part of the glacier, the rest of the glacier starts to move even faster. You've taken that bottle off, or that bottle top off. So that's what we're facing. And you may be aware that we had about 3 years ago, and the calving of a huge component of Antarctica, the size of the state of Rhode Island. Now, that did not do much for global sea level rise because it was already essentially floating, but it's separated now, and now it will melt, and then it will contribute. And we're running into massive shifts that the climatologists really can't even believe. Now, that's just Mount Kilimanjaro, the tallest mountain in Africa. If you're my age, you actually read Hemingway as a kid, these short stories, and then you saw the movie with Gregory Peck and Susan Hayward and Ava Gardner, The Snows of Kilimanjaro. There are no more snows on Kilimanjaro. So you look at 1912, you look at 1970, 2000, and 2007, and this is sort of schematically represented over to the right. And the snow mass on the top of Kilimanjaro is relatively trivial. As a consequence, in the warming of the entire region, this used to be the part of Kenya where the colonialists would go to avoid malaria in the hot season. Well, now you have malaria all the way up, halfway up Kilimanjaro. You can get malaria. And that's because of expanded vector breeding opportunities because it's warmer and moister. There's also been a lot of deforestation. And so you throw that in and you have a lot of trouble in this region. Now, the most terrifying of all the slides, we'll get to the optimistic slides later. That's what we're going to all do about this. But the most terrifying slide is this one, the thermohaline circulation, particularly in the Atlantic current, the so-called meridional overturning circulation, the MOC. Now, these are the giant rivers within the oceans, if you want to look at it that way. So deep down, you have cold water currents. They rise as they come into the tropics, and then they return as warm water currents, the most famous of which is the Gulf Stream. So if you look at the Gulf Stream up here, take a look at just how far north, I think I have a pointer, can't see it. Anyway, you know where Norway is, where my parents came from, and Iceland, and take a look at how far north that is. That's Greenland, that's Siberia, that's northern Canada, okay? Now, why can people live in Iceland and Norway? It's all about the Gulf Stream. That's why those are habitable countries. They're way too far north to be habitable in a productive way. So what's happened is, for the first time in recorded history, we've measured the slowing of these currents. And nobody on planet Earth has a clue as to what that might mean. We do know that there has been systematic warming of and bleaching of reefs because of warming, so that the corals are adapted to slightly cooler water. You warm it up, they die. And it's also true that we've seen massive displacements of fish populations as they seek cooler waters closer to their millennially adapted physiologies. So this could be the most important consequence of global climate change if we actually see the substantial disruption of these currents, because we really don't know how this could disrupt the ecosystems of the globe. So here are the health issues: direct effects of heat. We have hotter and drier summers, and we can have heat-related deaths. We have warmer and wetter winters as a consequence, with the consequence of loss of polar and glacial ice. We have increased extreme weather events. We have property and crop loss, and we have loss of reef ecosystems, which disrupts fish yields. So you can see the direct effects on our food chain, and especially among the elderly and the very young, who are much more susceptible to things like heat stroke. And you may recall in Europe, it was about 15 years ago, there was a massive atypical European heat wave, and it's estimated that 20,000 or so elderly in Europe whose air conditioners were not working, or who didn't have air conditioners, and they called the air conditioning supply company, and nobody came because they were overwhelmed with other calls, and they essentially cooked in their apartments. And that has happened to a lesser degree in the US, but it's the kind of thing that we can anticipate. So are we as nurses, as in this case, maybe not pediatrician, but for the kids, are we as geriatricians, are we going to start taking seriously how well networked our elderly are in times of stress and emergency? Are we going to actually have plans to cope with heat waves and the inevitability that 1 in 20 air conditioner is going to break down during this period and isn't going to be fixed because the companies are overwhelmed? Are we going to plan for this? These are the sorts of adaptation issues that we have to think about, and there are plenty of direct heat effects that we're going to have to worry about. Perhaps the most dramatic example of a direct heat effect is desertification. So the Sahara Desert is moving south in the Sahel region of Africa at least 100 kilometers per year. And that is displacing the grazers and farmers who have lived in these Sahel border regions with the desert. And this is the kind of phenomenon you'll see when you go there, people having abandoned their dying animals and having to migrate. Tremendous stress, and if the vegetation animals aren't going to survive, the people have to move. Now we have this climatologic displacement, climate refugees that I just alluded to with my desertification slide, and extreme weather events, which also are going to face resulting in internally displaced people and sometimes even refugees across borders. That's the kind of definition. If you cross borders, you're a refugee. If you're displaced within your own country, you're an internally displaced person, just for the vocabulary. Now, I find this website to be fascinating. The Alliance of Small Island States. This is 35 countries and 5 territories, including all of ours. Members of the territories of this organization include Puerto Rico, American Virgin Islands, Northern Marianas Islands, American Samoa, and Guam. Those are the 5 territories of the United States, and they're all members of this. So what they are worried about is their existence. Now, take a look at what 2 different modelers using 2 different strategies did in modeling what will happen with 1 meter ocean rise in Florida in the next 30 years, and next 50 years, I think it is. And this is one modeler, and the ecological devastation that the entire Everglades are going to be swamped with salt water, it can't be understated. I mean, that'll be a dead zone. And then some very valuable real estate, including all of the Kennedy Space Center, will be underwater. And this modeler, the one to the right, is much more pessimistic, much greater saturation of seawater into the state of Florida. Now, we will spend billions and billions and billions and hundreds maybe of billions of dollars to build seawalls and mitigate this. So when we say we can't afford to tackle climate change, that's because people are thinking in 2-3 year economic windows. They're not thinking in 20-30 year economic windows. Now, as temperatures rise, more and more water vapor evaporates into the atmosphere. That is fuel for storms, as any climatologist will tell you. And the more heat and water in the atmosphere with warmer ocean surface temperatures increases storm wind speeds. And there are analogous temperature phenomena on land which increase the strength of tornadoes. So we can expect greenhouse gas emissions and global warming to result in more extreme weather events, and we've already seen it. Now keep in mind too that snow reflects heat. It's white, reflects. Whereas rock absorbs it. Dark absorbs it. You learned that in grade school. And with freshwater snowpack and glacial losses, loss of snowpack, loss of glaciers, earlier rain on snow, we are going to see new cycles of floods and then droughts. And I'll circle back to that in a few slides. And the costs of these events are vast. There are 15 Atlantic hurricanes that have cost at least $10 billion each of damage. And the king and queen of these hurricanes were Katrina in New Orleans and Harvey in Houston, each of which resulted in $125 billion worth of damage. And it just is a miracle to me that our political leaders argue that we can't afford to mitigate and adapt to climate change when we're incurring these kinds of costs, and we will be incurring vast new costs for dubious technologies like seawalls that may or may not work. Now, vector-borne diseases, this is sort of more my field, and in our school we do a lot of work in this space, and that's a long list, and I hate lecturers who give you slides with long lists, but I couldn't resist. Just to let you know that you've got mosquito-related infections, because mosquitoes, remember, if the mosquito is here and I'm malarious, it has to bite me, then it has to live the sexual life course of the malaria parasite, which is now the male and female that are finding themselves in the sporozoites are going to mature after the oocysts mature in the midgut. That takes 8 to 12 days, depending upon the species. So the mosquito is not going to infect Anne if it doesn't live 8 to 12 days. But if we help it live 8 to 12 days by being warmer and moister, then a greater proportion of all the malarious mosquitoes will survive to infect others. So you can see how that could have radical rise in malarial incidence. Similarly, arboviruses and many other vector-related infections in which black flies like warm, moist environments, so do snails, so do rodents, so do tsetse flies and reduviated bugs, so do ticks, and you can even have water that is warmer for a longer period of time that might harbor cholera and other waterborne disease for a longer time. So that's the story. And here's Zimbabwe, where 10 years ago, those were the highlands, which were largely malaria-free, and 30 years from now, there will be no malaria-free zones of the nation. They will all be hyper-endemic or even holo-endemic for malaria, holo-endemic being one notch even more intense in terms of transmission than hyper-endemic. Then we have population pressures and shrinking land and water assets. That also includes fish assets. Now this slide comes from Lake Victoria, and you recall that that's a lake that borders Uganda, Kenya, and Tanzania. And if you look at 1960 and take a look at the population density, and then you go all the way forward to 2015, you'll see massive population growth and pressures on the lake. And the fisher folk who live around Lake Victoria and make their living supplying protein-rich fish to the population, they are now harvesting smaller and smaller and smaller fish. It's exactly what happened in the Grand Banks off of Newfoundland, the richest cod fishing zones in the entire world that were fished out about 30 years ago and have never rebounded. The codfish have never rebounded in the Grand Banks, which was mind-boggling to those of us who remember that from our childhood, where that was the teeming source of codfish, and now you don't fish for cod in the Grand Banks, because there isn't any more cod. And the prospect of overfishing, overgrazing on the land, deforestation, farmland pressures, is almost certainly going to result in hunger and climate refugees in this very intensively populated part of the world. And guess what? We're repeating this story in lake after lake after lake ecosystem all around the world where population pressures are severely affecting. Here's the Aral Sea, and the historic Aral Sea is what all the blue represents, and the current is just this dark blue, and you can see how the historic was this vast area and the current is like this. That gentleman is standing where the sea used to lap, where the sea used to reach. And there's a navy worth of vessels that are completely abandoned, because not only is there much less water in the Aral Sea, but it's now saline water for all practical purposes. Great Salt Lake kind of thing. And there are no fish in the Aral Sea that can be harvested. This is from crop growing, in which the rivers were diverted to feed the very water-thirsty cotton plants, and extensive use of pesticides and fertilizers, most of which end up in the Aral Sea eventually, poisoning the fish. Now, the exact same phenomenon is happening in Lake Chad, which is a fraction of its size. Chad, Nigeria. It's estimated to be about half the size that it has been historically. And those of you who have some California roots, I went to high school and college in California. The Mono Lake used to be this vibrant, large lake in Northern California. It's a wasteland now, because all that water was used for urban water supplies and did not have adequate restoration capacity. Now, you can't mention water, lakes, grazing without mentioning forests. Because if you go to 10,000 years ago or 5,000 years ago, more than half the habitable planet, so 77% of the globe was habitable. So get rid of Antarctica and the Arctic, et cetera, and get rid of the highest mountains of the Himalayas, and look at the rest. That was 77%. So this represents 100% of the 77%, of which more than half was forest. Even in 1700, more than half was forest. It fell to below half by the time we had 1 billion people on Earth in 1900, and you had 8% being used for crops and 16% for grazing, and that has doubled in a little more than 100 years. So now we're using 15% for crops and 31% for grazing land. And I don't know if this surprises you, but it sure surprised me. If you'd given me a quiz and said, you know, get this answer right or I'm confiscating your, favorite pet, I would have bet on grazing, on cropland being more than grazing land, but grazing land is more than double. And a lot of deforestation is happening to accommodate our thirst for meat. our hunger for meat would be a better term. And that is kind of what we're looking at in a 48-hour period. Those are the active fires going on in Latin America. And you can see how the Amazon is deforested and then burned to prepare it for grazing and for crops. Now, I have offended people in audiences with this slide. It's from the UN, and I want to explain it clearly. So the United Nations estimates that 222 million women who live in low and middle income countries would like to have access to contraception, but they do not have access. That's what we mean by unmet need for contraception. We're not talking about coercing anybody. We're not even talking about convincing anybody. This is when you ask, would you like to space your children and not have a child every year? Would you like to control the fertility within your family structure? And they say yes. And do you have access to contraception so you can control your fertility? They say no. Would you like it? Yes. That's unmet need. If we could meet that unmet need, that would handle demand in 50 million of persons under the age of 25. 14 million of them are under the age of 20. And 162 million of them are in the world's poorest countries, where you have the least capacity to have a family of 10 or 12. That would prevent 63 million unintended pregnancies, and it would prevent 19 million unsafe abortions. And it would also save 82,000 mothers' lives directly. So education and sustainable economic empowerment, especially for girls and women, does a lot to advance control of fertility. We've seen that in study after study internationally. There are exceptions where, for example, you have very strong pronatal sentiments, orthodox religions, for example, of various sorts, where there's a very strong desire to have very large families. So then the education and economic empowerment formula doesn't quite work. But in every other environment, it works very well. So there's a vast unmet need. And keep in mind that when I was born in 1954, there were 2.7 billion people on Earth, and now there are 7.9 billion people on Earth. And it took us 100 years to double the population previously, and it's taken us half of 100 years to increase it almost threefold. So we either take global population control seriously or we don't. If we don't take it seriously, then you're going to have a lot of underfed children in families that are not able to support 6, 7, 8, 9, 10 children and didn't want that number of children. There's a lot of individual and community tragedy, but there's also an existential threat to planet Earth, because reasonable people have argued that 7.9 billion people is too many people for a good quality of life for people on Earth. And we can do a lot if all we do is meet unmet need. So I dwelled on this slide to make sure you understand my point of view. I am not looking to coerce anybody. No one-child policy, no nothing. Just meet the need of women who want contraception. Meet that need, and we will do a lot to turn to the right direction. So let's take a look at events in the past 2 years, 2020, 2021. We had Australian and Western USA wildfires that were the worst in the history of those two countries, by far. The largest, the most intense. We had tremendous challenges in smoke exposure and poor air quality. And we had a lot of mental health impacts. People who lost everything, lost their homes. Some people lost lives of loved ones. Firefighters were lost, on and on. I've already mentioned the temperature records of the past 8 years, being the hottest ever, but there are also local venue hottest day ever records that have been broken in a historic sweep from Siberia all the way to Arizona and Florida. Places that broke their records by 5 degrees Fahrenheit, 10 degrees Fahrenheit. There was one place in Siberia that broke the record by 40 degrees Fahrenheit. And 2020 and 2016 were the hottest years in recorded history, although 2020 isn't that different from 2021. In fact, they were judged to be virtually indistinguishable. COVID had an interesting result, which was a favorable impact on greenhouse gas emissions, because there was less driving, there was less industry and the like. But the impact on food supply chains were very complex. Some places were not severely impacted, other places were severely impacted. So I can't exactly cheer for COVID having done us much good, because a lot of these are now rebounding to historic levels of greenhouse gas emissions. Finally, we'll talk about evolving drought and flood cycles and famine risk. So this is a map where they are showing the size of glacial regions in the Himalaya. And the loss in glacial size is represented by the red color. If it's white color, no change, and if it's blue, a little bit of an addition. So overwhelmingly, a loss, especially in the glaciers that are closest to population areas that are feeding the Indus River, the Brahmaputra Ganges River, and the Mekong River deltas. Now, 1.5 billion people live in these deltas, and what is now happening is early, three-week shorter snowpack and earlier melting and earlier springtime flooding and later summer drought. So it's not actually a net decline or increase in total precipitation. It's more rain, less snow, and earlier snowpack melt and glacial melt with greater volumes in the rivers early in season and then drought volumes later in the season. And none of this is good news. None of this suggests that we are going to have farmers and villagers better off with these conditions than they've been historically. They're going to be worse off with early floods, late droughts. Here is Borneo over about a 19-year period, and if it's green, it means forest, and if it's orange, it means no forest. And to the right, you have northeast Brazil. If it's blue-green, it's forest loss. If it's red, there's forest, different kind of infrared photography. And to the left, it's because of deforestation and population pressures, grazing, and a little bit of oil exploration. Not a little bit, in certain areas, a lot of it. And to the right, it's all mining. Of course, I could have taken a different picture from Brazil in the Amazon. It would have been due to deforestation. So there is a lot going on in our world that is not favorable. Now, the good news. With research, policy, education, action, this is both feasible and necessary. We can confront global climate change and at the same time take a look at issues of loss of biodiversity on our planet and human overpopulation. So efficient transportation looms very large. We are burning fossil fuels when we could be using solar power. So 3 years ago, my wife and I went solar in our house. Cost us $33,000. We got about $10,000 back from our taxes in the feds, and we got about $3,000 back from the state. So that was a net of $20,000. We pay virtually no, just the hookup fee, and we bought an electric car, so our electric car is powered by our solar panels. And are we going to change the history of planet Earth? By no means. But I'm hoping we might influence our neighbors. And I'm hoping you might do the same and might influence your neighbors. In other words, there has to be some level of tipping point where some of us get ahead of the curve take a risk on new technology, because it's not new anymore. Solar panels, prices have plummeted, and it really is very favorable if your home happens to be properly suited. You know, some people live in the middle of the forest, and short of cutting down a bunch of trees, it won't work. But many of us have some solar exposure, and we can go solar. So that's at the micro level, but at the macro level, you can do what Bishop's Farms. How many of you have had a pie from Bishop's out in Guilford? They are completely carbon neutral. It's not because they're buying carbon credits. They've become carbon neutral because they've deployed a number of their orchards, and they have turned them into solar farms. So all of the energy utilization of, I think they have some gas vehicles, but they're selling enough, they're installing enough energy, solar energy, into the grid to balance that. We can do so much more here at Yale. My building, the LEPH building, many of you know, 60 colleges, is out of 150 buildings on campus that had energy audits, was the 15th least energy efficient. I'm ashamed to walk into that building every single day. And they've done some mitigation, remediation, I should say, and I think we're not quite that bad, but they haven't done the definitive things. And we can power electric cars, buses, trains. There's nothing stopping us now. We have the technology. Energy conservation. The notion of having it at 68 in the winter and 72 in the summer is not that big a sacrifice, but people don't do it. And it just enrages me when I go into a public space in the summer and I'm sorry I forgot my sweater. Because we just keep it, the Europeans think we're nuts because they don't do that. And you go into a hotel in Europe in the middle of the winter and you better have a sweater because it's a little chilly. And you go in the summer, it's going to be a little bit warmer maybe than you're used to. But we just have to adapt. We're just wasting energy. We have double the energy utilization of the average American than the average European. We have automatic shutoffs. We have LED buildings that we ought to be promulgating. We have many other sustainable energy sources. And I put nuclear in yellow just to stimulate conversation later. And economic incentives, cap and trade, carbon credits, tax credits, and the whole notion of sustainable land use and population stabilization. Do we really have to eat as much meat as we do? Do we really have to have as much grazing land as we have? Couldn't we take advantage of the fact that it takes 10 kilos of plant protein to grow 1 kilo of meat protein? Couldn't we eat some of that plant protein instead? The answer is of course. Now, political change and commitment is essential, and we need better leadership. There was a moratorium on fossil fuel exploration with massive shift to alternative energy sources. How many of you noticed the announcement last week from the Biden administration? Opening up hundreds of thousands of acres of land for oil exploration again. And that I call the Ukraine policy setback. And I put that in yellow because that might be of interest to us to discuss in a moment. Commitment to conservation with policy shifts, as I mentioned. You know, we've had tremendous success changing tobacco attitudes, changing drinking under the influence attitudes. You know, you don't smoke in airplanes anymore, you don't smoke in buildings anymore, and we have much higher tobacco taxes, and we've seen tobacco use drop. We can work with our economist friends, and we can create incentives to make it more expensive for you to pollute and less expensive for you not to pollute. And if we don't do it, we're in trouble. We need aggressive preservation of wild places to enhance biodiversity and mitigate CO2 release, reforestation, control pesticide use and pollution. And there was a lot of good advice coming out of the Glasgow conference. I'm proud to say Yale, colleague of ours, Secretary Kerry, is spearheading this now as the international climate change at the cabinet level, I might add. And we couldn't ask for a better voice. Now, the emergency response and planning, this is something that's in our bailiwick as nurses, as planners, public health folks. We need to anticipate heat waves, drought, and extreme weather, modeling, forecasting, relocation of persons, doing the flooding and storm. We can plan for the unknown knowns. We know it's going to happen, we don't know when. But we can plan for it so that when it happens, we're ready. What about if we had taken the advice of the CDC in 2017 when they came out with updates of their pandemic influenza prevention plans, which was like a roadmap for what we should be doing to get ready for COVID. We just didn't know it was COVID. But it was largely ignored and largely set on a shelf, and then we had COVID and we weren't ready. We knew what to do, we just weren't ready. Incentivize and improve the appeal of vegetable-based diets. The head of Yale Hospitality here is incredibly creative. He and his experts have lopped off half of the meat consumption of Yale undergraduates over the last 5 years with nary a peep. Through creative use of vegetables, creative menus, and strategies for making foods appealing that are largely plant-driven. If he can do it, we can do it in our households, and we can do it in our institutional settings. And control of air and water pollution is a no-brainer. Vector control, bed nets, community engagement. That's a big one, because we've got to educate. Water and hygiene innovation, the old drip technologies that the Israelis taught us 60 years ago in the kibbutzes. Protect the environment, retain ecological diversity, and the contraception agenda. So the kids know we've got to do something. Greta Thunberg, the South Africans have faced this in a big way. There's my favorite Bishop's Orchard. And here are our divestment protesters saying, yeah, Yale, with your $44 billion endowment, do you really have to be owning fossil fuel companies? Really? Can't you be a role model for others? And this, I want to end with habitat loss is a major threat to biodiversity. I've kind of gone over my time, I think. Am I right? I'm okay? Okay, well, that's a miracle. So habitat degradation, exploitation, invasive species, pollution, climate change. Those are what are affecting fish, mammals, reptiles, and amphibians and birds now. And you can just expect the climate change blue to grow and grow and grow. So this is kind of 10 years ago, and it's just going to get worse on the climate change side. So we've already had tremendous threats to habitats and biodiversity. It's estimated we've lost 3 billion birds in North America in recent years. And insect populations have plummeted as well. And you might say, well, that's great by me. I don't like bugs. But that's what the amphibians eat. That's what the birds eat. That's a vital part of our food chain. And why are we losing insects? What are we doing to the planet that's resulting in the loss of insects? That's an even more compelling issue. So we are very focused on education. I was so proud when the very first year that we launched our climate change and health certificate program, we had 3 nurses. They were all from Mass General. And I asked them when I had an opportunity, why are you taking this course? They said, well, we're the 3 people who care the most about climate change in the nursing school at Harvard. We all happen to be at Mass General. We're all helping each other. We're going to take your curriculum and we're going to work it into the nursing curriculum of Harvard University. And I just was the happiest man because to me, that was the whole point of the climate change certificate. And now we have it as a MOOC, a mass online something. What does MOOC stand for? Course, somebody knows. Mass online something course. Open course, open. Online open course. And that's, I can't remember if it's free or if it's $49, but it's incredibly cheap. And that's pretty much everything here without the love and attention. And we have our new climate change and health concentration in our MPH. We have an emphasis in our executive online MPH. So we even have people who live in Milford and Madison who are taking this just because it's so much easier when they're working professionals. But then we've got people in California and Louisiana and elsewhere. And then we're doing K through 12 outreach for education in our schools, a lot of community outreach talks to all sorts of audiences. I gave a talk to the Connecticut arborists, the people who chop down trees and replant them. And, somebody had heard me talk and they asked me to give a talk, so I schlepped up to West Hartford and met the arborists. And anybody else who wants to hear about this. Now, you happen to be in an epicenter of expertise right here in this building. You can read about it on your own website. And you spearheaded this graduate forum and Global Youth Summit just last year. Dean Kurth co-chairs the Sustainability Committee. She's one of 3 deans on that committee, and she's a leader, Yale and nationwide, in this space. And I'm not kidding. She literally educated the president of our university, and that's why planetary health is one of our major priorities. It was deemed a major priority by the by Scott Strobel's old science committee, but it was not well packaged, and it was not well presented, and Ann fixed all of that almost single-handedly. And then Associate Dean Nelson spearheads planetary health in its global context, being the Associate Dean for Global Health and Planetary Health, something like that. I wanted to mention Jodie Sherman and the work she's doing on healthcare environmental sustainability. Those of you who are deeply engaged in hospital care, which is a number of you, this is very much focused on the fact that if the hospitals and healthcare environments of the world were a country, they would be the 11th largest greenhouse gas emitter. So the healthcare industry itself is one of the worst offenders in terms of greenhouse gas emission. And that's because we use it once and throw it away. That's because we have our anesthetic gases, which we're pumping, and only 3% is metabolized and 97% is re-released. And on and on and on, all sorts of reasons. You want to get active, call Jodie. She is a force of nature and doing very fine work out of the School of Public Health and the medical school, and working also with Ann. And many other nursing resources. Yesterday or day before, I did a PubMed search. I found 775 just for climate change and nursing. That's all I did, simplest search in the world. And nearly half of them were from the last 3 years. And I found a couple from Ann in the Journal of Nursing Scholarship, 2 of them. And I also found this collaboration of the Alliance of Nurses for Healthy Environments, and it's Nurses Climate Challenge. I accidentally put an apostrophe. They don't have an apostrophe. Nurses Climate Challenge Initiative, collaborating with Health Without Harm. And these are a couple of resources there. So nurses are at the forefront of the demand that we do something about this. And I think public health people are too. I'd like to get our medical schools on board. I'd like to get our universities on board, and we can actually make a difference. So thank you for your attention. A few sites from our site, and looking forward to tea. So who wants to talk about Ukraine or nuclear power or any other topic? Any questions or comments, please? Yes? Okay, so I'm an old-fashioned guy, and I saw the China syndrome, and I lived through 3 Mile Island and Chernobyl. And if you ask me, do I want to live next to a nuclear power plant, I'd say no, thank you. On the other hand, nuclear power is very benign from a greenhouse gas emissions point of view. you produce a vast amount of energy with no greenhouse gas emissions. I'm not saying that the process doesn't have some greenhouse gas emissions, but it's a tiny, tiny fraction, and you generate vast amounts of energy. One massive problem, well, two problems. One is safety, 3 Mile Island, Chernobyl, Fukushima. But the other is, where do you put the spent nuclear fuel, which still is radioactive for the next 30,000 years or whatever. And we thought we had a plan for Yucca Mountain, which was vetted for 50 years as a highly stable mountain, seismically inactive, a natural depth, and a place that you literally could store. And the Nevada senators and congresspersons were too powerful. And they put a kibosh, and President Obama abandoned the Yucca Mountain plan. And now we're storing it all over the place. San Onofre in California, not far from where I went to high school, is storing all of their nuclear waste right there on site. And they've walled it off, and they've got it, but it's sitting there near the Pacific Ocean. And you know, all these experts are saying, oh, it can stand the big one, the big quake. I don't believe that for a second. So they're storing it there because they have nowhere to take it. So if we were serious about nuclear, we would have to get very serious about issues like, if you're going to put this near water, because you have to have the cooling, so you have to put these near water, or you have to have water available, then you better think about a tsunami. And you better think about the big earthquake in California. You better think about all of the safety considerations. So we need a coherent safety approach, and we need a coherent nuclear disposal approach. But I have changed my mind over the years. I think that the urgency of the global warming crisis has to make us rethink nuclear. Now, I'd much prefer that we reduce our energy consumption. I'd much prefer that we go solar and electric. I'd much prefer many other things, but I think we're going to need nuclear too. Now, the French have shown it can be done safely. The French have had the highest proportion of nuclear power in their grid of any country in the Western world, or I think any country anywhere. And they have never had a nuclear accident. But their nuclear waste storage is still suboptimal. So that's what I personally think about nuclear. Yes, please.
You talked a little bit earlier about the attitude of short-term planning versus long-term planning, and I wondered if you had any examples of whether that be domestically or abroad of people who are doing a good job of saying like, okay, we need to look at the 40-year plan, the 50-year plan, as opposed to like the 4-year political elected office term, and how to kind of string that together. Is anybody doing a good job of that we could role model by?
Well, I might pluck out the Danes. So the Danes figured there was a big problem 30 years ago. And they invested massively in a resource that they have, a lot of other people don't have, which is known as the North Sea wind. And I think the second largest wind farm in the world is off the coast of Denmark. And it's in a part where it's out literally in the North Sea, not where there are intense bird populations. And they figured out the technology of how to seat the wind farm into the sea, and how to harvest the energy by bringing it, subterranean back to land. And I wish I could remember the proportion of all the energy grid in Denmark that's from wind, but it's a really high number, like 30% or something. And this is a test of concept. They proved it could be done. I have been to Xinjiang province, the province with a majority Uyghur population in northeast China. Now there is tremendous political disruption and discrimination and harm being done to the Uyghurs in that part of China. But before that, I had a project there. And I went through the largest wind tunnel, and this was between two mountain chains. They took advantage of the natural wind that was feeding this big valley. And they built a wind farm that was further than the eye could see, all with modern wind technology. So there's a lot that can be done with wind. Solar technology has improved massively. And we have some examples in our own country of highly successful solar strategies. But I think where I'm most disturbed is when I go visit my son, my younger son who lives in Orlando, and I just see so few solar panels. And this is like, you think about Florida, you think about Arizona, and then think about Chad and Niger and Mali and some of the poorest countries of the world, and think about all the wasted energy by not harvesting the sun in these sun-intensive venues. And why can't we have a global campaign, not to mention COVID vaccine, but to mention solar panels in high sun zones? You know, this is cherry picking, something that would be relatively straightforward, because fewer solar panels would be more efficient in high sun regions. But even in low sun regions, even in a cloudy day, you can harvest energy from a solar panel. Now, I was personally disappointed with the Biden administration decision, because I'm at the point in my awareness of this problem that I feel that we can't be compromising at every turn. If we say that federal lands are not going to be used for oil exploitation, then we stick to it. And if we have a problem with gasoline prices being too high, we look the people in the eye on television and we say, do you have a bus that goes from your home to your work, or a train? Could you call a neighbor? Can you cut your gasoline prices by carpooling? What can you do to help the Ukrainian people at this time without our sacrificing our grandchildren's future in a warm world? And why can't we call on the American people for a wartime response and draw on us for inconveniencing ourselves and reducing our dependence on oil by conservation? That's what I would have liked to hear from the White House, not, okay, we'll open up 180,000 acres of land, I forget how much it was, for oil exploitation, which we're not even going to get that oil for 2-3 years. So to me, that was a very cynical bid to win votes. Hate to say it, that's what I think.
Sten always says what he thinks. Oh, I'm sorry, thanks.
I just had a question. While you were speaking, you made some of the resolutions could be moving more towards electric cars. And my question mainly was, what are your thoughts on the school of thought that say that moving towards electric usually produces batteries, which also produce waste, and also increases the demand for certain chips that are needed for these kind of electric cars, mainly mined from, I think Congo has like the biggest cobalt mine, which also has been plagued with some form of child labor violation. So what are your thoughts regarding the reconciliation? Because now moving towards electric, some people may see it more like maybe as a privilege, and also the side effect of being kind of like lithium or cobalt electric battery waste, that in the long run, it kind of, what thoughts have been that it kind of reflected back to these lower income countries that already are bearing the brunt of like the first hand of the heat. How do you tackle these kind of things?
Very legitimate and important point. I have been to many oil-rich countries in Africa in particular, and I've seen vast income with very little benefit to the people. Angola, Gabon, Nigeria. I've seen vast exploitation of humans in the oil industry, and I've also seen tremendous pollution impact in these settings. So I'm not saying that we don't have a problem with rare earths and minerals that are required for nickel and the like and battery production. Congo is one of the major producers. China is another one of the major producers. So I think, yes, we have a problem in consumption of products that are often yielded from an environment like Russia, which now uses its oil money to wage war on the Ukrainians. So there is a challenge on both sides of the equation. On the battery power needed for electric cars and for the oil and gas needed for the fossil fuel consuming cars. So I think one would need a more complex analysis, shall we say, of overall harms. Now, can we demand that Tesla and GM and Ford source their materials the way that we've tried to demand that global diamond manufacturers source their materials? That blood diamonds are not permitted and they have to be tracked, et cetera. So there may be mitigating elements that we can do in the sourcing of these materials so we don't have the choice between abusing Congolese children and climate change related catastrophe 50 years from now. So I think we have to recognize them, as you have done, address them, and resolve them. And that would be my choice rather than say, forget electric, we'll go with the gas stuff because, it won't hurt Congolese children. Well, it's going to hurt Nigerian children. It's going to hurt Gabonese children and Angolan children. So I'm not saying it's a wash because I'm not expert enough in the topic to comment, but that would be the way I would think about it. Thank you.
Well, I would like now to do the other part of this annual tradition, which is the Whistler tea. I'm going to invite all of you to that reception. A tea for Sten, no red meat. In school, we try not to use red meat in what we offer. And I want to also thank, of course, Neve Emerson, Lauren Langford, Olivia, and Jaleesa, and everyone who helped put this together today.
Thank you.
And most of all, we want to thank Sten.
Because of the movies, they're a little too big to email, but they're on box sent to Ann's office, and they're on this computer. Anybody who can use any of these slides for any purpose, please do. Thank you.